ago, the NDP made a commitment to all Manitobans, Mr. Speaker, that they would end hallway medicine. Manitobans bought into that promise, Mr. Speaker. Just over the last weekend, Mr. Speaker, I was in an emergency ward and I saw people lined up in hallways, Mr. Speaker, in the hallways. My question to this government is, how can you spend so much money yet deliver such a sloppy service when it comes to health care in the province of Manitoba?
Back in September 2008, Manitoba experienced its worst ever incident in emergency. For 34 hours, Manitoba sat in the emergency here at the Health Science Centre, waiting to be looked at. He died after 34 hours. This is a death that should never have occurred.
Mr. Speaker, my constituents don't want to hear the gobbledygook from this minister, Mr. Speaker. The bottom line is this government promised back in 1999 to get rid of hallway medicines in our hospitals, Mr. Speaker. They have failed. They have failed and failed, Mr. Speaker. Just this last weekend, we're still getting people in the hallways. It's degrading. It's humiliating as a patient to be sitting in there. This government has failed in recognizing the problem. Mr. Speaker, they have funneled their money in terms of healthcare bureaucracy. What I'm asking this government to do is to overhaul the bureaucracy, put the money into healthcare workers, Mr. Speaker. That's what is needed. We need more money for healthcare workers. It's this minister and it's this government that has failed Manitobans, not the healthcare workers, Mr. Speaker.
Every year, the government spends tens of millions of dollars in health care. Where are they spending the money? Stop spending on bureaucracy, start spending on the backbone of our healthcare system, our nurses and our doctors and so on.